Well, good afternoon, everybody. It's Wednesday, June 17th. This is Terry Walsh, the Executive Director of the Sunset Hills campus. I'm glad to be with you today to give you some updates on some things that we know now. So I'm glad that I'm able to join you today. I don't think this is going to take as long as normal, but I do have some things to share with you. One of those is, last Friday we did celebrate an entire week of not having anybody who was positive for COVID-19, the coronavirus, on our campus. But then we ended up having somebody, and here's how it happened. So as you know, the entire week we had all the residents in our village care center had essentially recovered from COVID-19 and returned back to their normal accommodations. That was great news. Our staff in the care center did a great job with that. In fact, the same thing was also true in Chesterfield. In the Village Care Center in Chesterfield, the staff had done a great job there, and all of those residents in Chesterfield also graduated from their COVID care center and went back to their normal care center population and their accommodations. So for an entire week, neither of the Friendship Villages had anybody, any residents at all at any level of care who was positive for COVID-19. That was a great cause for celebration for us, with the caveat that the war's not over yet, and it certainly isn't over, and it wasn't over because now we have a couple more people that have it again. And here's what happened. In Chesterfield, for example, we began a new program sponsored by the state of Missouri to have blanket testing for every resident and all the employees in the care center in Chesterfield. So even though every resident who had ever shown any symptoms automatically got a test, and so we would know individually if a resident had COVID-19, we had not tested everybody just for the sake of testing everybody, the blanket testing. So anybody that had had any symptoms at all before this new blanket testing got tested, and then we would know if they were positive or negative. Well, with the blanket testing that took place last Wednesday in Chesterfield, we discovered Friday evening when those test results came back that 2 residents in the care center in Chesterfield did in fact have COVID-19. Their test came back positive, but neither one of them had any symptoms whatsoever, so there would not have been a cause for any of them to have been tested previously to be treated for COVID-19 because neither one of them had any symptoms before. We only discovered it in the blanket testing that everybody did. So both of them are actually doing fine, and neither one of them still have any symptoms, but the test showed that they were positive, so they're being cared for as if they were COVID positive because the test said they were. They should be able to graduate again this Friday, and go back into the population. In Sunset Hills, a little bit different situation. All of the residents were recovered that had it, and we had 6 of them at one point. All of those had recovered and gone back to their normal accommodations. Then we admitted a new resident from the hospital, straight from the hospital, for Medicare Part A. Now our rule is we don't admit anybody from the hospital unless they've tested negative 2 times before they leave the hospital. So this person did. They had tested negative twice from the hospital before they came to the care center. Well, when they got off the transport vehicle at the care center, we did our screening for that resident, that new patient, new resident. They're not normally a resident here, but they came from the hospital for their rehab time. And so they were running a low-grade temperature when they got off the van here at the care center. Well, because they had a low-grade temperature, our routine practice is to do a COVID test on them, and so we did. Even though they had tested negative twice at the hospital, they tested positive when we ran the test here. So then they're already in the facility by that time, so we keep that person. They've been isolated since that time and has been treated as if they were COVID positive, which the most recent test that we took showed, but nobody around them has shown, in fact, has been tested. Everybody around that person has been tested since then and has come up negative. So that's a good thing. We've got it isolated, and it's only that one person in the care center, and they're doing fine. I think their temperatures actually subsided, so their symptoms appear to be gone at this point, but they had still tested positive. So we have to go through the time frame, the 14 days of that person being assumed positive for COVID-19, because that's what the last test did. And so they're okay. Nobody else is catching it from them, essentially, and they don't appear to be symptomatic. But our 1 week of having nobody on the campuses, either campus, with COVID-19 ended last Friday evening, when we discovered we had two more back in Chesterfield and one here. So it's under control. There's no epidemic happening. Both the teams at both care centers have it under control, and everything's fine. But it did kind of spoil our celebration of being COVID-19 clear on the campuses. We've still had no independent living residents that have had COVID-19. We've had a couple people tested, because some people have gone to the hospital for procedures. And so one of the new protocols now at the hospital is to get tested anyway before you go into a procedure. And so we've had a couple of residents that have done that, but they've come back negative, and we're happy about that. So we still haven't had any residents in independent living that have tested positive for COVID-19. We're very happy for that. We've had some residents who were in the care center during the time of the COVID-19 episode in the care center that have now since gone back to their independent living residence, and so they're fine and everything's good. As you know, now that we have released or relaxed the discouragement of non-essential trips off campus as of last Saturday, and I understand a whole bunch of people went out and got their hair cut and did some other things that they needed to do, and that's great. I'm really glad we were able to do that. I know that you're grateful and happy that you were able to go visit families and friends in their homes, and I know a lot of you did that. I just ask that we continue to be very mindful of all of the protocols that you all know, to make sure that you wear your mask whenever you're out among other people, that you maintain your social distancing. I know that's hard to do with the grandkids when you're visiting the homes and everybody's jumping around on you and they're happy to see you. You have to be careful about that. You've got to continue to wash your hands or use hand sanitizer very frequently. And then, the no contact rule, which of course is always in effect, but I know it's hard to do. So you've got to do the best you can. We have to rely on you to do the best you can so that you don't bring it back in to the campus if somebody should get it. Now, so far so good. Nobody's done it yet, but it's only been a few days. So we may have our own little resurgence of COVID-19 on the campus in a few days after people have come back from visiting their friends and family and not knowing what may have happened out there. So we are praying that nobody got anything over the weekend when they went out to visit. And let's hope that that's not the case. I do know that the news channels have been showing some new guidance from the state of Missouri that unfortunately it wasn't interpreted very well or reported very well on the news channels about opening up the nursing homes in the state of Missouri. They said that the state has now allowed for the opening up of nursing homes for visitors in the state of Missouri. Unfortunately, those news reports were not very comprehensive or complete, and certainly didn't reveal all of the strings attached to this new apparent relaxing of the regulations. Now, as I've shared with you in the past, we have to follow more regulations and guidance than just from the state of Missouri. They're not the only people we have to listen to. We have to listen to the Centers for Medicare and Medicaid Services, CMS, because we receive government funds for some of the work that we do in the care center. We have to listen to the St. Louis County Department of Health as well as the state, and then policies and so on from the CDC, the Centers for Disease Control. So we have many different avenues for people to provide guidance for us. So the state relaxing a state policy isn't the end of the story in terms of opening, quote unquote, opening up nursing homes for visitors. But if you actually do look at the fine print and the actual documents that the state has changed or is now quote unquote opening up, we are actually almost perfectly in alignment with their new guidance already. So the term opening up for visitors isn't really what it sounds like. It doesn't mean opening up inside the building for visitors to come inside the building. In fact, there's very, very little language in the new guidance from the state about indoor visits. The focus is on outdoor, outside visits and what we do for them. Now, we've already changed that policy. In fact, I believe over the last day or two, we've had our first new grouping of outdoor visits where we can take residents in the care center outside, and we've set up this wonderful tent outside of our care center, and Chesterfield's done the same thing. We can take residents outside, residents who are not COVID positive or presumed to be, but either have never been positive or may have been positive and had recovered. Anybody who's COVID free outside to visit friends and family outside under the tent or wherever they want to be outside on a coordinated and scheduled basis. So we started doing that. In fact, yesterday, I believe, we had 37 families come and visit their loved ones from the care center outside. They did it outside. And so that's really what the state guidance is now, is you can permit these outside visits with all the caveats about whether that resident has been COVID free and so on and so forth. So we're already doing that. We are actually literally, we were ahead of the curve on that guidance and that protocol. So that's a good thing. We were already ahead of the curve. We were already doing window visits before. Now we do the full outside visits where we bring the resident outside now to visit with the family, but they still have to maintain at least a 6-foot distance, the no contact policy, everybody has to wear a mask, everybody has to use hand sanitizer, all those things. That part hasn't changed at all. The confusion comes into the perception that the state has relaxed the policy on indoor visits. And the difference in reality versus the perception is that the indoor visits, even in the new state policy, cannot happen unless that nursing home is COVID free. Not one person in the nursing home has COVID-19 at all for a period of 28 straight days in that care center or nursing home with nobody with COVID-19. 28 days since the last person recovered from COVID-19. Well, we're not there, and right now we've got somebody there that has it, the one I just described who came from the hospital. So we, even now, if they recovered today and we're all done and everybody gave them a clean bill of health and no more COVID-19, it would still be 28 days from now before we would even be able to consider allowing an indoor visitor in the care center. So that's really the rule that the state put out. So when they say in the news report that the nursing homes can open now for indoor visitors, it's not exactly as advertised. There are a lot of strings attached. So we can't have indoor visitors yet. We still can't do it. Only the state is the only entity that has even suggested we could do that. But the other 3 entities we have to listen to, Medicare people, the CDC, and the county, none of them have agreed to that policy that the state has supposedly changed. But then even if you look at the fine print in the new state policy, there are a lot of strings attached that won't even permit that anyway, unless the care center has not had anybody positive for COVID-19 at all for a period of 28 days. So it's going to be a while, we think, before we're going to still be able to have any indoor visits in the care center, but we are doing the outdoor visits now. It's been very popular. The families are, it's an exciting thing to watch. I was at the care center yesterday looking at the tent and how it all works. They had just had one swarm of visitors come and go, and they were in between the next set that were going to come later. But it is a very exciting thing. The families really like it. The residents who hadn't been outside in months, now 2 months, were happy to be outside in the warm sun. So it was a great thing, and we're doing the same thing in Chesterfield. But those are the actual rules that were not reported on the news story, so I just want to let you know what those are, because that's what's happening now on our campus, both campuses here and in Chesterfield. And it's a little bit confusing because we want to hear and read certain things into what the news report said versus reading the fine print. So I just wanted to be able to explain that for you. On another topic, you know that we are very near the end of our fiscal year. I did show you a chart or a graph last week. That hasn't changed since last week. We are doing well. We're ahead of budget for the year. So our year is almost over at the end of this month. A large portion of that reason is because we have delayed our opening of memory care a little bit longer. And some other things. So some of the startup expenses that we thought were going to hit in this current fiscal year that's about over kind of got moved to next fiscal year just because of the calendar and when the fiscal year ends and begins. So we're going to end the year in really good shape this year. Next year is going to be tough because the challenges we are expecting this year are going to happen next year. So it's going to be tight next year for us, but I think eminently doable for us. The budget has not been finally approved, but we have finished negotiating the budget with our governing board finance committee. It will now go to the village board for discussion and recommendation to the full board, and then it goes to the full board for approval or rejection, as the case may be. That's all going to happen next week. But whatever the case, as far as a direct impact on you, you already know what your rate increase is going to be, 3.75 for this year. That begins on July 1st. So we're still waiting for a final affirmation of our proposed budget, which affects annual pay raises for our employees. It affects capital expenses and what we can do on the campus physically with our buildings and our grounds. And all of those things, there's a lot woven into the budget for next year, and we should have approval for that about a week from now, this time next week. So that's the information on the financial picture. Otherwise, we're doing fairly well on other avenues. I know the food is still good. I eat it for lunch every day, and everybody else is getting that. So I think we're doing pretty well on that front. We've got a lot of other activities. I know some of our fitness classes and other small group activities are still going. You know, we've started those back up. I know the chaplains department has restarted a lot of the spiritual care programs, as long as we still maintain the small groups. So that's really good to see. It's good to know that you're able to get out and about in the community and take care of the business that you need to take care of. And it seems to me that the spirits have lifted a lot around the campus for those of you who've had business that needed to be conducted for a couple of months and weren't able to do that, and now you can. Again, all I ask is that you continue to do what you do to protect yourselves and others. You know that we have lifted the requirement for brand new residents coming onto the campus. When they move in, there used to be a 14-day quarantine requirement for brand new residents moving in, and now we don't do that. They still have to maintain and monitor their own temperature and other symptoms if they feel that they have a COVID-19 symptom, and report those to Amy Meek, but there's no longer that requirement for quarantine for a new resident. Whenever a new resident comes out of the hospital, though, not a new resident, any resident comes out of the hospital, because we know the hospitals have COVID-19, and there's a concentration of COVID-19 in the hospitals because that's where people go when they have it, if they need to go to the hospital. We do ask our residents who've been to the hospital for any period of time first to talk with Amy Meek, and some of those, because of the conditions, might have to go into quarantine when you come back from the hospital because of the risk of the exposure that you've had, only by nature of where you've been and what else is going on at that particular hospital. So Amy works with everybody on that. We know we have a couple of residents who are self-quarantining because of their potential exposure and their proximity within the hospital to other potential COVID patients there, just like the one that we admitted, who had even tested negative twice but ended up having it anyway. We've got to be careful about those things. So we do take those precautions. Our goal is to keep you safe. Our goal is not to keep you sequestered and hidden from the rest of society. Our goal is to keep you healthy and safe. So we don't like having to do this. It's not that if we wake up in the morning wondering how we can tie everybody down and keep you from doing things. That is not what we want to do. But I would much rather have everybody healthy and safe and happy than tied up and sick, and perhaps even on a ventilator or other things happening that we don't want to consider. So we're doing what we can to keep you safe. We still follow the guidelines that we have to follow. Some of you have asked me if we're able to relax the group size gathering requirement of only 10 people or less. Right now, that's still the limit. In terms of group gatherings of 10 or less, there may be some opportunities for us to make exceptions for those. And I would ask that you bring those to me or the executive director in Chesterfield, if you're watching this from Chesterfield, and bring those requests for exception to us so that we can evaluate the situation. Depends on the venue and where you are and how spread out you might be able to be and all those sorts of things. There are a lot of factors that can go into this decision. So if having a gathering of 10 people isn't going to cut it, and it means you have to not do something when you really had 11 people that needed to be involved or something of that nature, we're certainly willing to make considerations for that based on the circumstances and the environment and the situation. So you're free to bring those to us and for us to consider especially in those particular situations. I hope you're all doing well. Again, this is kind of a shorter update. I don't have a lot else to share with you at this point in time. We were going to do our live town hall meeting on Channel 900 from the ballroom, and you would get your report from Jill on all the construction project, which is going along very nicely, as you might have already seen. The care center is almost fully sited now. The siding is up almost everywhere on the new care center. The courtyard area is getting near completion. My understanding is that the water feature might finally be near completion. We've all been waiting for that for a long time. So a lot of things are beginning to happen now that are noticeable for you. So things are going along very well as far as that goes. And so we will be able to have those reports for you. I don't know if we're going to have the live all resident meeting next week or not, because I'll be in the board meeting where the budgets are going to be approved, which happens to be in the same time frame as what we would be doing for the all resident meeting live show from the ballroom. So we might have to delay the live show from the ballroom for a couple of weeks from now, and it might just be another video recording of me, which of course everyone likes to see most, for next week, and then have a live show probably the week after that. But we will let you know how that's going to go next week. But I know now, sitting here thinking about this, that since I have to be in the board meeting, which is going to be in Chesterfield next week, we may not be able to do a live show from the ballroom next week. It might have to be the week after that instead, where you'll get your update from Jill and from anyone else who has, and from Bobby and others on some of the activities that are coming up. I invite you to look at your newsletters and watch Channel 900. I know that our Channel 900 got upgraded on Monday, so now music can play when you're watching the slide. The information slides go by, and then it will automatically turn off when a video comes on, so that it doesn't drown, the music doesn't drown out the sound from the video. So that's an upgrade we literally just installed on Monday. So our Channel 900 system is a little bit more sophisticated now. So I think you're going to find that to be an improvement, where you can listen to music while the information slides are going by, and then it'll automatically turn off the music so that you can hear a video such as this one when the time comes for that. So I think that's going to be a big improvement for everybody. You may have already noticed that already by now. So We're continuing to do all those things to try to improve what we're doing on the campus. That's a never-ending proposition for us. Our team does everything they can every day to find better ways to take care of you and to provide services that are even better than what we did yesterday. So that's always happening. I'm glad to be with you. I hope you have a great day. The weather's nice. It's starting to get warm. But I hope you're able to get out and about now in the community and go visit your families and friends. All I ask is that you continue to follow the protocols and the safety measures that we've talked to you about for 2.5 months, about wearing your mask, no contact, maintaining your social distancing, and washing your hands or hand sanitizing frequently when you're doing it. Otherwise, everybody's doing a great job. I'm happy to see you. And I get around the campus a little bit here and there, and I get to see you sometimes in small groups outside. Saw a small group in the crossing bridge yesterday, and other places. So I'm happy to see all of you. And if you see me and need to ask a question, please don't hesitate to either stop by or stop me, and hopefully I can answer your question. Great to see you. I hope you have a great day, and we'll talk to you again next week. Thanks now. Bye.